Nice to see you again. As always, I am with you, virtual speaker Alex, and we begin. Have you ever felt a sudden rush of overwhelming fear, your heart racing and your breath quickening, even when there's no apparent danger? If so, you're not alone. Panic attacks can strike anyone, anywhere, and at any time, leaving you feeling trapped and bewildered. But what exactly are panic attacks, and how can we regain control over our minds and lives? Stay tuned, because today we're diving deep into the world of panic attacks and exploring effective strategies to manage them. Welcome back to our channel. If you're new here, make sure to subscribe and hit that notification bell so you won't miss any of our mental health insights. Today, we're discussing a topic that affects millions of people worldwide: panic attacks. These intense episodes of fear can be debilitating, but understanding them is the first step towards conquering them. Panic attacks are not just a fleeting moment of anxiety, they can be life-altering. They can impact your daily routine, your relationships, and even your overall well-being. But fear not. With the right tools and knowledge, you can learn to manage and overcome these frightening experiences. So let's get started. Panic attacks are sudden periods of intense fear or discomfort that peak within minutes. Symptoms can include heart palpitations, sweating, shaking, shortness of breath, feelings of choking, chest pain, nausea, dizziness, chills, or hot flashes. You might also feel detached from reality or fear losing control or dying. These attacks can occur unexpectedly or be triggered by specific situations or stressors. And while they can feel terrifying, it's essential to remember that they are not life-threatening. The body's fight-or-flight response is activated, and while it might feel like a heart attack or a nervous breakdown, it's simply your body reacting to perceived danger. But why do panic attacks happen? They can affect anyone, regardless of age, gender, or background. Often, they are linked to stress, anxiety, or traumatic experiences, but they can also occur without any clear trigger. Understanding your own triggers can be a significant step in managing panic attacks. Let's take a closer look at some of the common signs and symptoms of panic attacks. Recognizing these can help you differentiate between a panic attack and other medical issues. 1. Physical symptoms. As mentioned, heart palpitations, sweating, shaking, and shortness of breath are all physical signs. You might feel dizzy or faint, or you might have stomach discomfort. 2. Emotional symptoms. Many people report feelings of impending doom or fear of losing control. It's not uncommon to feel detached from yourself or your surroundings, a sensation known as depersonalization. 3. Duration. Panic attacks usually peak within 10 minutes but can last up to 30 minutes. Understanding this can remind you that the feeling is temporary. Recognizing these symptoms can help you understand what you're experiencing and remind you that it's a panic attack, not a heart attack or something worse. Now that we understand what panic attacks are, let's talk about effective strategies for dealing with them. Here are some powerful tools you can use. 1. Breathing techniques. One of the most effective ways to combat a panic attack is through controlled breathing. Try the 4-7-8 technique. Inhale for 4 seconds, hold for 7 seconds, and exhale slowly for 8 seconds. This can help calm your nervous system. 2. Grounding techniques. Focus on your surroundings to bring yourself back to the present. The 5-4-3-2-1 technique is useful. Identify 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. 3. Positive affirmations. Remind yourself that the panic will pass. Use statements like, "I am safe," "This will not last forever," or "I can handle this." 4. Mindfulness and meditation. Regular mindfulness practice can help reduce anxiety and improve your response to stress. Apps like Headspace or Calm can guide you through meditation sessions. 5. Seek professional help. If panic attacks are frequent or severe, consider speaking to a mental health professional. Therapy, particularly cognitive behavioral therapy, CBT, has proven effective in treating panic disorder. 6. Lifestyle changes. Regular exercise, a balanced diet, and adequate sleep can significantly reduce anxiety levels. Also, limit caffeine and alcohol, as these can exacerbate anxiety symptoms. Now that you're equipped with knowledge and tools to deal with panic attacks, I want to hear from you. Have you ever experienced a panic attack? What strategies have worked for you? Share your experiences in the comments below. Your story might inspire someone else who's going through a similar struggle. In closing, remember that panic attacks, while distressing, are manageable. You are not alone in this journey, and there is hope for a calmer, more controlled future. By understanding panic attacks and implementing the strategies we discussed today, you can take back control of your life. As we wrap up, I encourage you to take a moment for self-reflection. Think about how far you've come in understanding your mental health. Every step you take is a step towards empowerment and healing. If you found this video helpful, don't forget to subscribe and sign up for our newsletter for more resources and support on your mental health journey. Together, we can break the stigma and foster a community of understanding and resilience. Thank you for watching, and remember, you've got this.